New mask guidance from the CDC to share, affecting even those who have gotten their COVID shot. Want to get it to our health and wellness reporter Sonia Zad this morning because this is a reversal from what we've heard before from the CDC. And I know that you just spoke with an infectious disease expert a few hours ago about all of this. So what's new?
Okay, basically experts are saying whether or not you're vaccinated against COVID-19, you are now encouraged to wear a mask indoors. They say with the more contagious Delta variant spreading, masking is really one way to slow the spread of this virus. So they're specifically asking everyone in K through 12 schools to wear masks, as well as anyone living in parts of the country where high levels of the virus is circulating. I asked Dr. Todd Ellerin to clarify that second part for us last night during our chat on Facebook Live.
Now, they didn't say that everyone needs to mask, but what they did say is everyone who lives or travels to a place that has substantial transmission or high transmission. Many counties within the United States, probably more than 50%, fall into one of those two categories, which means if we follow that guidance, which I think we should, that we should be masking when we're indoors.
Okay, so let's talk about this Delta variant, shall we? Dr. Ellerin says there's been a 300% increase in cases nationwide in the last 4 weeks, and more than 85% of COVID cases occurring right now in the U.S. are that Delta variant. The vaccinations are lagging. Only about half the country's vaccinated. The Delta variant is twice as contagious as the original strain, and it's most contagious. That means it's the most contagious to date. Mark?
All right, I appreciate the update, Sonia. I know you've been doing a lot of Facebook Lives during the pandemic, and folks have a lot of questions. What are you hearing asked most often?
So one of the questions that came up last night during our Facebook Live, do symptoms of the Delta variant differ from the original strain? This has come up a few times, and I think it's a great question. The UK did a study on this. Classic COVID patients, generally we've heard, have fever, cough, headache, achiness. The fully vaccinated breakthrough cases that we're seeing now, though, according to Dr. Ellerin, are more cold-like. So less fever and more congestion, sneezing, runny nose, headache, some of that achiness still. Lack of taste and smell did show up as well in some of those patients in that UK study, but on average, their illness is more mild and the symptoms last for a shorter period of time. I want to also get to Amy's question. Amy asked, if a group of people are all vaccinated, is there any need to mask? So Dr. Ellerin said, look, this is a tough one. We need to think about the possibility that we could be going out in the world, right, doing our thing, and bringing the infection back into our homes, even if we're vaccinated. So just another reason to mask when we leave the house, or certainly if we're with other people indoors. Now, do we know exactly how this Delta variant spreads outdoors? No, but there's a lot of dilution in the air, so we think that there's much less transmission outdoors. Not saying it could not ever happen, but that's a consensus right now. But here's the deal. If you're immunocompromised or you have what doctors call comorbidities, or are hanging out with someone who is, let's say, elderly, diabetic, pregnant, overweight, or obese, has chronic disease, that could be lung disease, heart disease, etc., you really do need to be aggressive about masking indoors. It doesn't matter where you live in the country, by the way, for this part either. If you're young and healthy, Dr. Ellerin said, look, gauge your risk as an individual, and it makes sense not to always feel like you have to wear a mask, depending on the situation. You can see my full conversation with Dr. Ellerin from last night. That is on my Facebook page. Mark, back over to you.
Yeah, a lot of great questions. Thank you for that, Sonia. Coming up.